My name is Dave Grandy. I'm a special advisor to the Secretary. I joined DHS back in the spring, and one of my big areas of focus has been developing a strategy along with a large team at DHS around how we think about addressing social determinants of health, and specifically through an 1115 demonstration waiver. And so we're very excited about this work. We've gotten to the point last Friday where we were able to post a draft application for the 1115 demonstration waiver. And what we're focused on is a new set of programs and initiatives to address social determinants of health and critical life transitions that we think have an enormous impact on health, quality of life, and the use of healthcare services. Can you go to the next slide, please? Oh, back up one. There we go. So we know, and you all know, that where people are born, live, learn, work, and play has an enormous impact on health. We've certainly known this for a very long time. I'm a clinician myself and practice general internal medicine, and certainly have had many experiences over my career in medicine of really seeing how the social determinants of health can really be a powerful influence on people's ability to manage chronic conditions and other key life events. And so what we're really excited about is new opportunities from the Centers for Medicare and Medicaid Services to design and evaluate new and innovative programs to address social determinants of health. And it's all part of our goal and CMS's goal to develop a Medicaid program that helps people get what they need and stay healthy. And it's an opportunity to address some of the greatest challenges impacting health during key life transitions. And so, as you can see on the slide, we're focusing on 4 key areas right now. The first area is around reentry supports for those returning to communities from prisons and jails, then housing supports for those facing homelessness, food supports for those facing food insecurity, and finally, closing coverage gaps for young children under the age of 6, which we know is a critical time period in life. And so this 1115 application and the programs that I'm about to talk about are still in development. We are looking forward to receiving feedback on what we posted on Friday, and we're currently in an official state public comment period, which ends on January 2nd of 2024, right after the new year. Next slide. So the idea of social determinants of health or social drivers of health is probably a familiar term to many, but the Centers for Medicare and Medicaid have introduced a new idea called health-related social needs. And so you may ask, what's the difference between these quote-unquote health-related social needs, or HRSNs, which is a term you will see in our 1115 waiver application. It really is the same idea as social determinants of health. But what the federal government is saying is that states, while they're creating opportunities within the Medicaid program to design and implement new programs, that to address these social drivers of health, they have to be social drivers that are directly impacting a clinical condition. So for example, food insecurity that's impacting diabetes, or homelessness that's impacting mental health. And so that's the framework that the federal government is providing to states to address social determinants of health. And it's a very exciting time, and I think this represents a lot of new federal funding and flexibilities that haven't existed before. So we see very diverse states from across the country moving quickly to apply and seek approval. It's a very long, diverse list from across the country. Some examples: Arizona, Utah, Montana, North Carolina, Washington, our neighbors next door in New Jersey, and many more. And part of the excitement is that for the first time, the federal government is not requiring 1115 waivers specifically addressing health-related social needs to be budget neutral to the federal government. And so what that meant was, before, if you applied for 1115 waiver, you essentially had to prove that you weren't costing the federal government any more money with the programs that you were implementing. And so they've changed that in this space of health-related social needs, and I think that creates a lot of opportunities for us. But again, in order for that to happen, there's two key requirements from the federal government. And the first is that for Medicaid to take on a new role to address unmet social needs, those unmet social needs have to be combined with a clinical condition and directly impacting that condition. And then second, as you'll see, many of the programs and services are not permitted to be indefinite, and so they put a time limit on how long things can be provided. But nonetheless, we see it as an exciting opportunity for the state to begin to invest in new areas that we think can have a big impact on quality of life and health outcomes. And Pennsylvania is also unique because we have had many pilot programs through our managed care organizations to address social determinants of health. However, many of those programs have been relatively small. And so an 1115 waiver is an opportunity to expand what works, continue to innovate, and bring in new federal dollars. Let's go to the next slide, and I'm going to walk through these four areas. The first that I mentioned is around reentry. And we know that transitions from prisons and jails are very challenging in a very high-risk time period where individuals face tremendous barriers. And as a result of those barriers, you end up seeing very high risk of death and poor health outcomes in that time period right after individuals are released. There's actually been documented up to a 12-fold risk of death in just the first 2 weeks following release. Overdose rates are certainly very high during that time period. And so historically, states haven't been allowed, due to federal rules, to cover services prior to release or even activate Medicaid coverage before people leave a prison or jail. And there was a federal law that changed that and charged CMS with creating these waiver opportunities for states so that we can reactivate coverage up to 90 days prior to release. And so what we're looking at is serving some of the highest risk populations with substance use disorder, serious mental illness, individuals needing support with activities of daily living, and chronic conditions where we know access to healthcare services, medications, and the like is very important. And then also pregnant and postpartum people. This is one part of our waiver where the federal government has pre-specified a lot of their expectations for states. And so what you'll see here is benefits and services that CMS has really said must be included. The first provision is that when individuals are incarcerated, that their Medicaid is not actually terminated, but rather suspended, which makes it much easier to reactivate prior to release. The second is providing individuals with intensive case management in that 90-day period with warm handoffs to clinical and social service providers to really try to make some of the transition smoother upon reentry to society. The third is medication-assisted treatment being broadly available for substance use disorder. Fourth is a 30-day supply of medications, and that means medications in hand prior to release, so individuals aren't left trying to find a way to access medications after release. Fifth is continuous eligibility for a year after release, so making sure that people maintain their eligibility and don't face gaps in coverage, at least for that first year. And then finally, help individuals find and keep housing. And so, again, this is a very challenging transition period for many individuals, and we think that these services can really improve health and quality of life by making these transitions a little easier compared to what they currently are. Next slide. So the second area is housing. And I think it goes without saying that housing is truly fundamental to health. It's impossible to be homeless and take care of chronic conditions and stay healthy. We know that homelessness can both cause mental illness or be a cause of mental illness. And so addressing housing is critical. We also know that there are studies that show that this makes sense from a cost perspective, that providing housing can reduce hospitalizations by up to 30% and reduce overall spending when you consider its impact on healthcare spending as well as other areas like criminal justice. We are proposing to include people experiencing homelessness who have serious mental illness, substance use disorder, certain chronic health conditions, pregnant or postpartum, or that population that I just mentioned that would be receiving reentry supports. And the services that would be provided would include that first step of navigation to helping connect people to housing supports. The next step of really helping people during the transition of getting settled into a stable housing situation with assistance with moving expenses or certain items that are essential to a successful and sustainable transition. Third is providing, and this is an area that is a really new opportunity from the federal government, is to actually provide short-term rental assistance for up to 6 months. Prior till now, that was prohibited by the federal government, and so this is one area of considerable new flexibility and opportunity for states, but the federal government is limiting that to a 6-month duration. And then we want to support people once they are housed and do so up to 12 months to help them stay housed. Next slide. So the third area is around food and nutrition, and food insecurity is both common and a cause of worse health, and certainly in the current economy and everything that's going on, we're seeing increasing rates of food insecurity. We also know that special diets are needed for certain chronic conditions, which are very challenging to access for many people. There have been national research studies that again show these types of investments in providing food and nutrition supports, particularly for folks with chronic diseases, can have a big impact on their chronic disease control, on healthcare spending, and can also lead to some savings in terms of reducing adverse consequences of illness, resulting in hospitalization and emergency room visits. And so there are not a lot of programs where you can improve health and save money, and we think this is a great example. Maternal health is another critical public health issue, and so we want pregnancies to start in a healthy fashion and create strong opportunities for individuals, and food insecurity can certainly lead to long and lasting negative effects. So we're looking at two populations in our food and nutrition program. So before I talk about the pregnant and postpartum population, let me come back to these chronic conditions. So we're proposing providing food and nutrition supports to individuals with what we refer to as diet-sensitive health conditions. And so what does that mean? It would be conditions like diabetes or congestive heart failure, where we know that diet adjustments are critical to managing the condition and staying healthy, and that access to those meals is incredibly important for chronic disease control. And so what we're looking at doing is providing what's called medically tailored meals that are customized to the medical condition. So these are meals that are prepared by dietitians who are specifically prepping a meal based on someone's medical condition and delivering those meals to someone's home. Again, this is an area where our managed care organizations have been piloting food programs for many years with great success. And so we think the waiver can provide new tools for these programs to reach many more people and have greater impact. And then let me come back to our pregnant and postpartum population. Again, we know pregnancy is a critical time period where food insecurity can have negative and long-term effects. We also know from food programs that have been piloted in the past that if you provide food and nutrition supports to a pregnant mom, their whole household is likely facing food insecurity, and they're likely to pass that food along to their children who are also facing food insecurity. And so what we are looking at is proposing a household level program to provide critical food and nutrition supports during this critical life stage. However, we also know that these programs are temporary. Again, that is by requirement from the federal government. They can't go on indefinitely. And so these programs need to be connected to long-term sustainable impact. So we're looking at opportunities for connecting the food and nutrition supports to nutrition education, navigation, and ultimately making sure people are connected to long-term supports through programs like WIC and SNAP. Next slide. So the final and fourth area in the proposed waiver is addressing gaps in insurance coverage for young children. And we know that gaps in insurance coverage can mean gaps in prevention, screenings, and early interventions. And that can have a very negative impact on not just that moment in time, but ultimately the life of that child as they get older. And so what we are proposing to do is to provide young children with what we call multi-year continuous eligibility. And that means once a child becomes eligible, they would generally stay eligible until they turn 6. So for example, a child at birth who is eligible would be guaranteed to maintain eligibility up until that birthday when they turn 6, and then they would have to go through a redetermination at that point. They wouldn't lose coverage for failure to submit forms or changes in their household circumstances. We know a lot of parents have changes in their income over the course of a year, and that can have detrimental impacts on coverage and lead to coverage gaps, and we want to make sure we close those coverage gaps during these crucial early years. Next slide. So, I want to wrap up by saying, hopefully you can tell from my earlier comments that we are incredibly excited that the federal government has created these opportunities and providing states with new tools to innovate and make critical investments to address social determinants of health that I think we all collectively believe will have enormous impact. Again, we've known about the importance of social determinants of health for decades now, but we haven't had the tools to begin to invest in addressing them and really trying to leverage the Medicaid program to improve people's quality of life and health outcomes. And as I said, I think the evidence that these programs are really exciting and promising is the large number of diverse states across the country who are moving quickly to pursue these opportunities. And so we too are moving quickly to make sure Pennsylvania can seize these opportunities as well. We know that there are a lot of states getting in line to have their 1115 waivers approved, and we want to make sure we get in that queue so that we're not waiting a long time. And so at the same time, we are trying to move quickly, but we also know that this process does tend to take a fair amount of time to get over the finish line with the federal government. CMS, again, that oversees Medicaid, they usually take the better part of a year to complete the approval process of a waiver. But we are doing everything possible to expedite that process. After our public comment period, we are anticipating submitting our final application once we've had a chance to address questions, comments, and concerns, and submit that to CMS by the end of January. And at the same time, we'll begin to, while going through the approval process, begin looking at what it will take to implement these programs. We've heard from lots of states that are a little bit ahead of us in moving this work forward, that it is a very heavy lift to solve all the challenges with having Medicaid become a mechanism to pay for services from organizations who typically have not been part of Medicaid networks and the more traditional healthcare system. And so when we look at implementation, we're looking at getting approved hopefully by the end of 2024. 2025 for many of these services would have to focus on infrastructure and capacity building with the launch of services in the second year of the waiver in 2026. So we want to move quickly, but we also need to do it right to make sure we're successful.